Hi, my name is Dr. Robert Gilliland. I'm a chiropractic physician. I'm also board certified in integrative medicine. Today I want to talk to you about the most amazing pain therapy that you've never heard of. It's called PEMF, or Pulsed Electromagnetic Therapy. So if you have pain of any kind and you haven't gotten results from conventional treatment or therapies, you really need to watch this video. PEMF has been around for a long time and it has had over 2,000 medical studies done on it, proving that it's safe and effective. PEMF therapy has been approved by the FDA for such things as delayed or non-union fractures, post-operative pain and edema, and certain cancers. Health Canada has certified the use of PEMF to treat severe depression in those who did not respond to medication. So, why have you never heard of this therapy? Probably because very few doctors are aware of it. I had to drive up to Tampa just to try this therapy out for myself. And it was amazing. Doctors are reporting a 90% satisfaction rate with PEMF and pain. Dr. Oz says PEMF will change the way we practice medicine. Watch this clip for yourself.
Today on the Dr. Oz Show, you don't have to live in agony anymore. Heal your chronic pain. No pills, no surgery.
Today, we are changing the practice of medicine. The FDA has already cleared pulsed magnetic therapy for fusing broken bones, treating severe, untreatable depression, and now to treat post-operative pain and swelling. Here's what researchers say magnetic fields are doing inside the body. Inside this mat, there are electrical coils. And when electricity passes through there, it creates a magnetic field that moves through the body. And it whispers. There's 75 trillion cells in your body. And it goes deep into your body, places where sports screens and heating pads could never reach. For example, down around the spine, where that red, angry area is. Now, the magnetic field turns on, and when it does it, it activates these ions, these charged particles. And there are proteins in there, and there's signals in there, stirs these things up. And these charged particles bring in nutrients, but they also begin to influence things like blood supply. Now, when the blood vessels are going in here, the red blood cells are actually stacked. See, they're stacked like that? They're not supposed to be stacked. When they're irritated, that happens. So when you pass magnetic fields through there, that yellow line, it opens up the blood vessel. It breaks apart these red cells. They're not stacked like coins. So you can get deep healing, better oxygen supply, so the healing process takes place. You don't just feel better, you are better.
PEMF therapy is unique in that it addresses the underlying cause of pain and can be used on any part of your body from your head to your toes because it's non-invasive and it doesn't heat up the tissue like most therapies with deep penetrating capabilities. So it's safe to use for people who have decreased sensations like diabetic neuropathy patients who might get burned with other therapies because they've lost a feeling in their extremities. You can use this over your head or eyes, which is usually contraindicated with other therapies. You can use it over knee or hip implants or even metal plates. The only contraindication for PEMF therapy is that it can't be used for people who have electronic devices inserted in their bodies, such as a pacemaker, cochlear implant, or an insulin pump, because it could possibly interfere with the electronic signal. PEMF works particularly well for TMJ, a notoriously difficult condition to treat, not only because of the pain involved in trying to get the bone back into the socket, but also the location because it's near the head and eyes. And PEMF therapy works great for TMJ. Listen to what this dentist had to say about PEMF therapy and temporomandibular joint dysfunction.
I've introduced it into my dental practice as well, treating TMJ patients. That's temporomandibular joint dysfunction. It's pain in the joint area. It can occur either bilaterally on one side, singularly. I've treated 9 patients to date, had favorable results in 8 of the 9, and they are coming back for second and third treatments and finding tremendous relief they had not had in many, many years. This is a life-changing machine, and I'm ecstatic about using it for myself and for my patients in my dental office.
Still not convinced? Listen to what Dr. Manny Alvarez has to say about PEMF therapy.
Hi, I'm Dr. Manny. You know, for days now, I walk a lot between the hospital, Fox News, and I have had a terrible, terrible pain in my heel. Now, I probably maybe have a heel spur, or probably I have an inflammation on one of my tendons here. So what I did, what Dr. Manny did, Dr. Manny's coming to the doctor. I am with Dr. Levine. Dr. Suzanne Levine is a foot surgeon and is trying out some new technology in her office. It's called pulse electromagnetic field therapy. Studies have shown that the magnets increase bone healing and decrease inflammation and pain, especially here. Ow!
Right here is a plantar fasciitis with inflammation and possible heel spur. And what we're going to do today is try something that's non-invasive. It's not going to cause any damage.
So no shots.
No shots.
No shots. I don't like shots.
No.
Okay.
No surgery.
No surgery.
And you should get an immediate response to the first session if it works.
Dr. Levine says that in the few months she had the device, she's seen a 90% satisfaction rating. I'll be the judge of that. Strap it on and magnetize me.
Okay.
It feels fine. It does not hurt. It's a nice pulsating sensation around the coil, which is pulsating right in my heel, which is the area that I want to get this inflammation down. Well, I got to tell you, it doesn't hurt. It's still pulsating. The proof of the pudding, my dear friends, in TV land is going to be if I stand up and my pain is much improved. The treatment is not FDA approved yet, but is being used all over Europe for multiple ailments like arthritis, fibromyalgia, migraines, depression, Parkinson's, and many other diseases. All right, so here's the moment of truth. I'm moving my foot. It feels that I can move it much better than I did before I started. Now I'm going to stand up, and I have to tell you that it feels much better. I came in with a pain number 8, okay? So it's a threshold of 8. Now I have probably a 4. So I feel that the pain has been reduced by 50%. But one thing that I do notice is that I can move it's a little bit more flexible. I'm not as stiff as I was before I came in. So perhaps there is a future to this technology.
You can see more testimonial videos by other doctors and patients, as well as find out more about PEMF therapy by clicking on the testimonial video tabs at the top of my homepage at www.bonitaspringspemf.com. Okay, I'm going to wrap this up by making you an offer you can't refuse. I am offering one free session of PEMF therapy in my office in Bonita Springs to everyone who qualifies until the end of September. Meaning that as long as you don't have an electronic device inserted in your body and you're not pregnant, you qualify. So call now and schedule your free PEMF therapy today before all the spots are taken. My office number is 239-444-3106.